Have you ever had a migraine that is associated with weakness or hemiplegia, weakness of one side of your body? This represents a type of migraine called hemiplegic migraine. With hemiplegic migraine, you have an aura prior to the headache, and the aura, typically you have weakness of one side of your body. Now you can also have gait disturbance, you can have problem speaking. Now the aura lasts for several minutes to hours prior to having the headache. There are two types of this hemiplegic migraine. We have the familial hemiplegic migraine, and that's an autosomal dominant. And we have the sporadic that is not genetically linked. It is important to make the diagnosis of hemiplegic migraine because the treatment can be different. Now, we differentiate it from a stroke. Typically, the patient is young, do not have any risk factors for strokes. And if we do an MRI of the brain, typically it is normal. Now, the treatment, we avoid the triptans, which is the classic medications that we use as abortive therapy for migraine headaches, because they can make the symptoms worse because they can cause vasoconstriction. We rely on naproxen, ibuprofen, IV magnesium, or we antiemetics. Now, we focus on preventative therapy. With the preventative therapy, we can use either verapamil, or we can use propranolol, we can use Topamax, or we can use amitriptyline or the CGRP blockers too. But the bottom line, it is important to make sure that we have the correct diagnosis for the patient, to educate the patient about this type of migraine so we can treat it appropriately. Thank you.